Step 64, luteal support during frozen transfer cycles. The reason we call luteal support is because in menstrual cycle, naturally, you have two different phases, follicular phase and luteal phase. First 14 days you develop follicle and you ovulate. First 14 days of your menstrual cycle is called follicular phase. After ovulation, the same follicle turns into a structure called corpus luteum and starts producing progesterone. From that day, it's called luteal phase. The first 14 days follicular phase, next 14 days is luteal phase. Similarly, in IVF cycles, we need to support the pregnancy with the progesterone. As soon as you started progesterone in IVF, that means that you are in luteal phase of your cycle. I will explain what happens in frozen cycles. In frozen cycles, if you are having natural induced or stimulated frozen cycles, that means you had an ovulation and your ovary is developed corpus luteum, one or two or maybe few if you had a stimulated cycle, and those corpus luteums are producing progesterone naturally. So here the main source of progesterone in the natural cycle induced or stimulated frozen cycles are the ovaries. And in addition to that, you have a pessary. So normally you start pessary or gel progesterone preparation few days before your embryo transfer. That's backup for your ovaries. Then once you have implantation, your placenta starts producing progesterone. In these three types of frozen cycles, you have three sources for progesterone: ovaries, pessaries or gel, and placenta. When you measure the progesterone levels 10 days after the transfer, when you check your pregnancy test, actually you are measuring total progesterone levels. So not only the amount produced from ovaries or placenta or preparations. If progesterone is low, it may actually be the sign that pregnancy implantation is not going well, because that indicates placenta is not producing sufficient amount of progesterone. In HRT cycles, because you shut down your pituitary, because you do not have ovulation, you do not produce your natural progesterone. So here only source of progesterone is a pessary or gel you're using, and once you get implantation, then placenta will be producing progesterone. In terms of duration of progesterone, in a natural induced or stimulated cycles, it is fairly safe to stop the progesterone at 8 weeks of gestation. Hopefully you have implantation, pregnancy. You do scan. Once you see the heartbeat at 7 weeks or so, you can stop progesterone at around 8 weeks or so, because here your ovary is still producing some progesterone, and plus placenta is producing progesterone. If you're at high risk of miscarriage or premature labor, then you should continue progesterone longer. On HRT cycles, because only source of progesterone is the preparations you're using, and hopefully you have a successful pregnancy and placenta, you need to continue progesterone longer, until 12 weeks. In addition to that, implantation and placentation in pregnancy needs estradiol in addition to the progesterone. In the natural cycles or stimulated or induced cycles, the estradiol is being produced from ovaries at the time, but here there's no other source for estradiol. That's why you need to continue your estradiol as well until at least 12 weeks. If you're using Proganova in HRT cycle, you need to continue until 12 weeks in addition to progesterone. These are the progesterone preparations: vaginal, rectal, and injections. Even if you have some bleeding, even if you think that your period started, you should not stop your progesterone until you discuss with your clinic, because you may have some implantation bleeding and your pregnancy may be continuing, and you should continue the progesterone until you're instructed to stop. Normally after 10 days after embryo transfer, you do blood tests for pregnancy tests. That includes two different types of tests: HCG, that's actual hormone produced from the placenta. So then second is progesterone. Really, we want to have HCG higher than 100 and progesterone higher than 30. After 48 hours, you repeat blood tests for pregnancy, HCG and progesterone. HCG should be doubling within 48 hours and progesterone should remain higher than 30. If this is the case, then after 3 weeks, you will have ultrasound scan By then you should be 7 weeks of gestation, and you should see the baby's heartbeat. Once you see the heartbeat, you will get instruction on whether you should stop your progesterone or continue, and you get referral for antenatal care.